Welcome to dBrief. Hi, this is Rashika, and I am your host for the day. I will be taking you through the highlights of the webinar on a very vital topic, COVID-related cardiology importance of hematology in COVID and corona attacks on vascular system. This was recently organized by DG Shield in association with IMA Pune on 11th October 2020. As per the recent update, coronavirus not only affects the lungs, it also damages the brain, kidneys, and heart. The virus attacks every major system in the human body, directly damaging the organs and causing the blood to clot. To remove the ambiguity and have a clear idea of the same, DG Shield joined hands with Indian Medical Association Pune to have an insightful discussion of the same. To begin with, Dr. Hasmukh Gujar, who is an interventional cardiologist, began the session by addressing the chosen topic, COVID related cardiology. He quickly went through the description of coronavirus and its broad spectrum of nature, which is already quite known to all of us. He began to explain the circular, which was shared by the WHO regarding the various cardiovascular presentation of COVID 19. Along with the complication, he listed out the various reasons which can lead to such complication. To understand OT interval in detail, let's hear it from him.
See, before starting medications, antiviral drugs or HCQS or azithromycin or any other treatment for COVID, maybe treatment for arrhythmias, a baseline ECG should be done mainly to see QT interval and corrected QT interval. In males, the QT interval is less than 440 and in females, the QT interval is less than 460 milliseconds definitely. But we should not fear if the QT interval is less than 500. Up to 500, definitely we can give medications safely. See this algorithm. Consider no ECG before start therapy if recent baseline ECG available with QTC less than 500 milliseconds and no history of structural heart disease, arrhythmias or syncope, no history of acquired or congenital long QT syndrome, and no bradycardia. If there is bradycardia, the QT prolongs. So if there is no bradycardia, no structural heart disease, arrhythmias or syncope, and QTC, corrected QT interval is less than 500 milliseconds, you can start the patient on therapy. If ECG is performed, or if QTC is more than 500, or 550 if the QRS field is more than 120. Remember the 500 letter. Then what to do? If QTC is less than 500 milliseconds, then definitely start treatment if there are no other comorbidities and no bradycardia. If the QTC is more than 500 milliseconds, then evaluate risk benefit of COVID prolonging drugs treatment. If the risk outweighs the benefit, then don't give QT prolonging drugs. And if it is necessary to give in COVID positive patients QT prolonging drug, then definitely give with the monitoring of QT interval. For suppose if the baseline QT interval is less than 500, you can start QT prolonging, you can start drugs and see repeat the ECG after day 1 on day 2 or day 3, and if the QT has not prolonged more than 60 milliseconds, you can continue giving the medication. If the QT prolongation is more than 60 milliseconds from the baseline, you need to stop the drug.
Dr. Sameer Milinkari, who is currently holding a position as consultant hematologist in Dinanath Mangeshkar Hospital, Pune, began his lucid speech on the topic hematology and COVID 19 infection. The COVID cases are generally divided into three parts: mild, moderate, and critical. He gave a brief idea of each case and the required assistance that's needed. He suggested that the virus may affect the hemogram of the patient and the thrombocytopenia is rare in patients, which is backed by several articles. The various drugs and their utility or side effects were discussed in detail. Let's understand thrombotic microangiopathy from him.
The other manifestations which we see is called thrombotic microangiopathy, right? So this is because of activation of complement by the virus. And this again is not DIC. This is you will not have elevation of the parameters that you see in DIC. And as treatment differs, the future research will tell us whether anti-complement drugs such as eculizumab, they've been shown in some patients to have worked extremely well, where the complement activation is completely stopped, and therefore the patients who were who were very sick were actually cured with eculizumab. But this needs more research.
The webinar came to an end when Dr. Advait Kothurkar, who is a consultant vascular surgeon, started to address the topic corona attacks on vascular system. He gave interesting insights about the Med Bikini movement and how it changed the world of the vascular system. He slowly dived into the cases which suggested the complications of vascular system along with the facts about venous thromboembolism. He shared some of the experiences that may be encountered in a non-ICU setting and concluded by suggesting some of the points which shall never go out of mind. Let's understand what they are.
So the inferences that we have with the arterial system is that COVID has a much worse prognosis when it is associated with arterial disease. Most of these patients do not survive. This is a more aggressive disease and it worsens rapidly. The survival with major arterial problems in COVID is poor. Arterial disease with mild asymptomatic COVID positive patients, they do well. The thrombus that we got out from these patients seemed to be more sticky. So this was a uniform observation all over India, that the thrombus is more sticky. So it seemed more like a sticky clot, and remote access like Fogarty. So you put in the Fogarty from the femoral and try to take it out from the popliteal. In most cases, the clot will move out, but this does not happen in COVID. It sticks to the wall of the artery, and you actually need to go back to the point where it is stuck and take out that clot also. So this makes us think that these clots are more fibrin rich.
Mr. Deepen Mehta, COO in DG Shield, took the chair where he discussed in detail how DG Shield is enabling doctors to safely and securely practice these testing times of COVID 19. DG Shield can conduct a quick and effective COVID 19 carrier risk screening of every patient before visiting clinics. You can log on for more information about DG Shield on www.dgshield.me. To view the complete webinar, click on the dBrief menu. For now, this is Rashika signing off till next time. Stay safe, stay strong.